as we get a little bit older, it's quite normal, isn't it, to start feeling a bit tired, a bit lacking in energy? Isn't it? Isn't it? What if it's a sign of something else? What if it's a sign of something that's actually quite easily dealt with? Feeling lethargic can be a sign that your body doesn't have enough vitamin B12, so I'm told, which is found in things like meat and eggs and dairy products. And a lack of vitamin B12 can cause symptoms that look very much like dementia. They maybe come out as problems with your vision or problems with walking. Well, I've been told about this by my first guest today. He's from Ingatstone. He found out earlier this year that he was suffering from a vitamin B12 deficiency. Terence Watts. Terence, good morning. Thanks for coming in. So what happened then? What was going on with your mind and your body earlier this year that made you wonder what was going on?
Well, it started after I had a viral infection, which was probably about the worst I've ever had, like sore throat and a cold that turned into a flu-y sort of thing, which lasted for about a fortnight. And I never really got better from it. I started to feel lack of energy, depression, anxiety, which I'm just not prone to.
In what way anxiety?
I started having panic attacks.
Right.
And since I work as a therapist, I recognise panic attacks.
Right.
I'd never had that sort of experience before. It crept up on me, it got worse and worse, and I had a health check. And because I'm a senior, they decided to give me a B12 screening.
Yeah.
And that showed it as being a little low. I immediately started on supplements, and within 3 days I began to feel as well as I hadn't felt that well in 10 years. So it creeps up on you.
So had this been happening for some time and you hadn't noticed it?
Yes, looking back over about the last 3 years, losing energy and a feeling of anxiety that crept up on me, then would go away again, then come back again. And with me, that was the first symptom. For some people, it's lethargy, leaden legs, and as you said earlier, difficulty walking and so on.
So are you sure it is vitamin B12 and not something like anxiety or depression?
I can be fairly certain, because when I started taking the supplements, within 3 days I was absolutely my normal self, the way I always was until 3 or 4 years ago.
So did you go to your doctor about this?
I did.
And what did the doctor say?
Well, the doctor agreed that yes, my B12 was low, and also wanted to put me on Prozac and citalopram, which I resisted.
Right.
Because I just wanted to see what the supplements did first. I could have had B12 injections, which what most people have, but high-dose supplements can work just as well, so that's what I take.
What is B12? What does it do?
It's cobalt, basically, and it affects every organ in the body. It affects vision, affects the brain particularly, which is why when it's left it can get misdiagnosed as dementia and even MS, and there are cases on record where people have been diagnosed with MS when they've actually got a B12 deficiency.
And cobalt? What's cobalt?
Cobalt is a mineral.
And what does it do to the body?
I am not too sure about that. I know you need it to stay well.
Right.
And you don't get it if you're a vegan, for instance. It's not in any plants or vegetables. It's only in dairy products and meat.
So it is something that as you get older, your body's less able to sort of produce it or maintain it?
We can't absorb it. As we get older, we're less likely to absorb it from our normal diet, especially if we've suffered any particular type of stomach difficulty. And most people's digestion begins to fail a bit as they get older.
So it is a digestive thing?
It is indeed, yeah.
Right. And so you've been on these tablets. Are you going to have to take these supplements?
Almost certainly, yes. To keep taking the tablets, as they say.
Have you done all this research yourself, or have you had somebody guiding you?
No, I've done this research myself. I'm very excited and interested in anything that I discover that I didn't know before. So I researched these things, absolutely. I spent days on the internet and poring through books, and was horrified to discover just how many people suffer from B12 deficiency without even knowing it.
But the point you were saying is that some people are diagnosed as having other things.
Absolutely.
And being treated for the other things when perhaps they have just a B12 deficiency.
Absolutely. People get treated for depression, anxiety, and are told quite frequently that they're feeling tired because they're older now.
Yeah. And so from what you have learnt, what are the long-term effects of B12 deficiency?
The worst long-term effect is that you can lose the use of your legs and affects the nerves in the spinal cord. It can turn to pernicious anemia, and once it's turned to pernicious anemia, you've got some real problems.
But it sounds as though it's so easily sorted.
It absolutely is. And vitamin B12 is a water-based vitamins, so you can't overdose on it. So you can just take supplements for it, and it cures the problem. If that's what the problem is, B12 deficiency, supplements help it.
And being really, really rude, to get some sort of age perspective on this, if you don't mind, how old were you when this first kicked off?
I first really noticed it earlier this year, so I was 71, but it's really started sort of 3 or 4 years ago, 67, 68. That's when I first began to notice it. Wasn't really extremely aware of it at the time. It's only retrospectively when I think, yeah, I can pinpoint the time when I started feeling anxious.
Yeah.
And I'm not normally an anxious person.
How do you feel now?
Oh, terrific. Absolutely fine.
No problem?
No, not at all.
So what would you like to see happen then?
I'd like to see people being more knowledgeable what B12 can do, or the absence of B12 in the body can do, and for blood screening to be more available, because it isn't. It's not discovered on a normal blood test. It has to be a special B12. One. Yeah, there must be a specific test for B12. And also folate, because folic acid can cause a problem too, lack of folic acid.
Wow. Okay, Terence, thank you very much indeed.
Thank you.